Hi, I'm Michael Smith from iBrokers, and today we're with Stuart Leatherby. Stuart has worked in insurance for almost 20 years and is current Chief Commercial Officer of Generali. So Stuart, thanks for joining us today. So I guess to sort of kick things off, could you, maybe just explain a little bit about what your role is at Generali, and I guess for the people who don't know, who Generali are and what you guys sort of do as an insurer.
Sure. So as you said, I'm Chief Commercial Officer for Generali Global Health. Generali Global Health is Generali Group's specialist division for the provision of international private medical insurance. So my role is really to develop out the products and the proposition that we provide in the marketplace to make sure that they're meeting our customers' needs wherever they happen to be in the world. And as a global provider, that's quite a diverse set of requirements and expectations.
Yeah.
As far as the Generali Group's concerned, it's the third largest insurance company in Europe. It's a huge presence. It is in a multidisciplinary insurer. That means that it's covering things like life insurance, but also non-life risks such as commercial risks and others, as well as obviously employee benefits such as health insurance. The business is a 70 billion revenue business. It's got about 70,000 people. It's present in about 40 countries, and it's an A-rated insurer. So certainly in terms of a presence, it's been around since 1831. So it's
Hopefully
one of the,
you guys know what you're doing.
it's certainly one of the oldest and most established insurers in the world. So for us, we do have a huge amount of financial strength, but also a lot of assets in the group that help us as a division to be able to provide the kind of solutions that our customers need.
Great. Well, we're here to talk in more detail about your individual choice plan, which is, I think, quite exciting for the market. I guess before we talk about the sort of specifics of the plan benefits and I guess claiming as well, which is always important when we talk about health insurance. It'd be good to understand a bit more about the plan structure and kind of how that works, and I suppose maybe where the plan's sort of targeted really.
Well, it's part of our choices range of products, and this is obviously as individual choice targeted on individuals and families. What we've tried to do is provide a wide range of plan structures that are really appeal to people at different times of their life. So we're not really saying that our plan is focused on one specific type of person, but what we try and look to do is to say, if there is somebody that wants to seek access to care outside of their ordinary country of residence, and so that means being able to access care potentially on a global basis, then this plan has been structured to enable you to do that whatever age you are and whatever your circumstances are. And the reason for that is the way we've structured it is very modular. It means that you can pick type or packages of benefits that suit your particular circumstances at any time and go up and down that scale as your circumstances change over time. So the way that we've structured the modules are that you have a core plan, which is really going to cover more of your hospitalisation and major medical care. The stuff that's really important, that's really financially quite a drain on people, and that's probably the most emotionally difficult for people. Then there are outpatient modules, which allow you to seek primary care and specialist consultations, have prescription medications, etc. That's more of, if you like, your day-to-day usage, where you've got minor ailments that need to be addressed. And then on top of that, you've got, if you like, a little bit more around changing lifestyle needs. So things like maternity care, dental benefits, vision care, all of those kind of things are then added as additional modules as you need them, and you may not need them initially when you purchase the plan for the first time. Wrapped around all of that is really something that we're very keen to promote, which is your whole health, your wellness in the longer term. Not just about us as an insurer paying for claims when you need to have treatment for a medical condition, but trying to make sure that you're able to manage your healthcare in the round. And that means health maintenance as much as it does mean, if you like, health cost because of treatment. And so we've put in wellness and preventative care benefits within our plan design that is just standard within the plan. So you're able to receive routine checkups, you're able to do cancer screenings, all of those sort of preventative care capabilities are within the plan, as well as a lot of health and well-being tools that you can use to just identify whether you might be at risk for particular conditions and what you can do to address those to try and make sure that it doesn't lead to any sort of complications further down the line. So as much as possible, giving people the choice to look after their healthcare and put it into their own hands to a certain extent, but to give them the tools to be able to do that more effectively.
Great. And so you mentioned the sort of tools and what are kind of provided on the plan. I mean, can you be a bit more sort of specific and explain perhaps what those are provided with?
Sure. So on the wellness and preventative care side, we've got things like just sort of nutritional information, as basic as that. Then we've got some symptoms checkers that you can use within our portal. You have things like health risk assessment tools so that you can complete questionnaires to find out whether you're at risk for any particular conditions because of just maybe some lifestyle choices or what have you. We've got an application that allows you to maybe manage your fitness and your health against some of your wearable devices that you might have, which are obviously very prevalent these days. So as much as possible, building out a number of different tool sets to enable you to manage that health, and then also to give you added convenience. So one thing that we do have is a virtual doctor service. So it allows you to access primary care and specialist care directly from your phone or tablet or desktop, and to be able to have either audio or video consultations so that you can do them from the convenience of your own home or the workplace, whenever, whatever time of the day it is, and in the language of your choice. So again, all around trying to make sure you've got that additional comfort and accessibility to healthcare when you need it.
So I guess, you know, on the virtual doctor side of it, great for people who perhaps live in remote locations or they may not necessarily have sort of that immediate access to a GP.
Yes, and there are a number of places in the world where a family GP system doesn't actually exist. In a number of places, you have to go straight to the specialist, and that means almost self-diagnosing. So,
which is quite dangerous.
Which is. So in a number of circumstances, it is quite a good thing to have that facility so that you can at least know directionally the best place to go. But it's also around convenience. There are a number of people, and our plans are designed for a wide range of circumstances, a wide range of people. But a number of people might be on short-term assignment somewhere and don't really know the medical facilities and don't necessarily have that language capability, and so might feel more comfortable accessing care in their own language with somebody who's been qualified in their country of origin. And so, again, this is more about what do I feel comfortable doing? Do I want accessibility? Do I want to be able to have that call at 10 o'clock at night because actually my family GP isn't open at that time? And maybe that is something that becomes an asset to them, and that they want that choice to be able to have that capability to do.
Great. And you sort of touched upon sort of families. So the plan's structured in a way where it's actually quite appealing for that family unit to all be on that same plan, really.
Yeah, what we've tried to do as much as possible is embrace the fact that families will want to use our types of plan through the whole of the family, and so therefore we've applied a family discount. We've recognised that it is quite an undertaking to buy a policy such as ours, and so therefore we want to make it as cost efficient as we can. We've also looked to try and promote your health and well-being as much as we can by trying to have a mechanism within our plan design that allows you to get better premium advantage in health maintenance than obviously utilisation of the plan. And I think it's in everybody's benefit to do that. And we've tried to structure it so that the more you're able to embrace that preventative side of things and the way that you can maintain your health in a better way and use the tools that we have, hopefully that will give you a better long-term benefit within the plan design itself and the premiums that get charged over that time.
So if you're kind of a sort of user who sort of has the plan working away in the background, but you you want to use it for that sort of emergency sort of situation. I guess, like us all, you don't really want to use it on that sort of regular basis. You kind of get rewarded for that through discounts at renewal and going forward.
Yes, we have mechanisms to do that. And I think what we've tried to make sure that we do is when we're considering that, any of your preventative care services that you've used will be taken out of that equation. So if you use perhaps your routine dental benefit, or you use your hearing test benefit, or your eye test benefit, or your routine and preventative care benefits such as cancer screenings, they won't be included because in the end we're about promoting health. Similarly, the virtual doctor services are not a fee charging service, so therefore they would not be taken into consideration either. So there are a number of things that we've done to try and make access to services that don't contribute, if you like, towards the premiums that are charged to you, enable those so that as much as possible we can keep your premiums at a competitive level in the long term.
Okay, great. So people sort of using, as you say, like the virtual doctors, it's not as if that is a benefit that starts to get taken out of your monetary amount on the policy benefit.
That's right. It's free to use. It's a free access point for you. It's cashless. So again, you don't get a bill for that, and it can be used as many times as you want. So there's no limit to the benefit for there. Not even the policy limit. It's an unlimited benefit to be able to provide to our customers.
Great. So I mean, the virtual doctor thing, I mean, that's kind of a unique sort of feature on the plans, really.
Well, yes, and I think what we're trying to do is embrace the way that technology and the way things are adapting to people's different circumstances and people's different way of wanting to approach how they receive the delivery of their healthcare. It's certainly the digital age is bringing a lot of different ways in which you can access care. Virtual doctor services being one of them. I think a lot of people will embrace the convenience of being able to speak to people in their own language, to be able to have that convenience of being able to speak to them whenever they want. So that might be 24 hours a day, 7 days a week. If they want to access care in the evening, they can do so. They don't have to wait for a surgery to be open or a GP to be open. So there's a lot of convenience around that. There's a lot of accessibility around that, and it does mean that you've got quite a lot of choice in terms of how you access that care. In a number of places around the world, there isn't a primary care mechanism. You have to go to the specialist directly. And this, to a certain extent, is saying, well, what specialist do I go to? Do I need to go to one?
Yeah.
Let's at least have that conversation first. And I can do that in the convenience of my own home.
And I guess for the locations perhaps where medical care isn't necessarily as robust as other locations, it kind of provides that more professional sort of medical diagnosis, I suppose, as well.
It does, and there's a lot of people that are in remote locations where access to care is difficult. And this is really providing that access on any device, mobile or otherwise. You can access that, and it doesn't matter where, how remote it is, as long as you've got a signal. Then you can access that. And I think for a number of people, that means that rather than just having access to a very small specialty or a small clinic which doesn't necessarily have the facilities, this gives you that wider depth to be able to access that care, and then to be able to pinpoint what your next steps are. So we think it's very exciting development. We think it's really just there to complement the program, the plan design. The plan design now, I think, is less just about, well, we pay claims than we maintain health. And it's part of what you're buying is I need to look after my and potentially my family's health. I need to do that in the long term. That means I go through different circumstances and I want different access points. Let's try and make that as robust as possible, and that's what we're trying to do with individual choice.
So I mean, you've talked about the sort of the plan structures somewhat, and it'd be quite nice to sort of delve into a little bit more detail about the actual benefits that are kind of provided over the various modules, because as you sort of say, you can make the policy kind of bespoke to what your sort of needs are and what your sort of situation is, really, as that maybe changes over time as well. So as the sort of standard benefits, every policy in the medical insurance world has to have hospital care. So you've got sort of three options for that.
Yeah, and I think they really just sort of work on the basis of that you have your main hospitalisation cover, which is if you have a medical condition that requires you to be hospitalised. In most cases, if this isn't a pre-existing condition that you've got, which it just evolves and you need medical care, then the plan has been constructed to cover those kind of things. But there might be some cases where inpatient treatment is required, which is a little bit different, and for different and very specific circumstances. What we've tried to do is to say there are graduatingly more benefits as you go up the scale, depending on what you feel that you would need in your time of life. So typically, if you like, for people who are buying this maybe in their 20s and 30s, they'd be looking more at a price competitive position, which covers them in the worst of all possible worlds, where they do need that hospitalisation. In other cases...
So that would be kind of more the silver kind of plan?
Yes, that would be more of the silver plan, which is our entry plan. For that, you haven't got things like outpatient surgical procedures, for instance. Whereas, if you then take cover a little bit higher up our scale, that would be included. But for a number of people, they would say, well, I don't really need that. What I really need is to protect myself in the event of something really disastrous happening, and for me to be protected for that. As we go up the scale, there's more that comes into play. So, for instance, and one of the examples would be newborn care. Now, obviously, if you're in your 20s and 30s, you may be single, you may not necessarily have started a family at that point, you don't necessarily need that cover. So we're trying to make sure that the coverage that we've got as you go up the scale is more relevant to your circumstances. And it might be that you have started a family, and so therefore you want a little bit more of protection for that. So that's where those differences lie, is what we try to do with the plan design is say, at different times in your life, you'll want different types of coverage, and you can move between those as your circumstances change. And that's why it's been modular in the way it's been constructed. So as you go up to the very highest level, it gives the highest level of benefits for the most circumstances that you might have. And so therefore it gets a larger level of coverage in lots of different areas. It will cover things like chronic conditions, and it will cover things like congenital anomalies that might occur. So there are a number of things that you can change as you go. And that's what we've tried to build in, is that somebody's requirements as a 20 and 30-year-old will be different to those that are perhaps a 40 or 50 or a 50 or 60-year-old. And so therefore, when you select, you're selecting according to your need at the time.
Okay, great. And I mean, just on the sort of inpatient sort of modules, so I mean, do you sort of see those being sort of country specific? I know obviously the Generali plans covers a number of locations, but would you kind of, you've obviously got the silver, the gold and the platinum, would you see those being particularly better in certain locations versus others, or?
Well, I think it all depends in the state of the healthcare system that you're in. Obviously, if I go into Europe, for instance, where there might be a lot more state healthcare provision, then you don't necessarily need as much in the way of the protection, because there is some protection already provided by the state. So therefore, it becomes much more of a supplemental type of cover, where it's giving you access to maybe medical facilities outside of your immediate country of residence. If you're in other places, you may need to have much more robust cover, because there isn't that medical infrastructure.
Exactly,
and I think when people are choosing the type of cover that they're looking for, they must firstly look at the state of the health services that are there, and then determine whether it's sufficient enough for them to allow some of that cover to be provided by the state facilities, or whether they need to make a purchase which is going to give them that additional protection where they feel that perhaps they haven't got quite the level of specialism within those medical fields to really give them that kind of comfort. So I think it all depends on where you are, where you want access to care, and then the type of access that you want. We talked earlier about the fact that in some places you've got primary care and you've got GP, a sort of family GP type of structure. In other places you haven't. In those particular cases, you may want a different level of cover depending on the circumstances.
Okay, great. And then I guess with the way that the plan is structured, so you sort of select your hospital plan, whether that's the silver, the gold, or the platinum, and then you add the outpatient to it.
Yes.
And again, that's over 3 modules as well.
Yes. And again, it's really about the extent to which you want outpatient cover. We talked earlier about the fact that there's, I guess your base outpatient is really, I want to go and see a GP because I've got symptoms and I don't know what it is. I need to go and see a specialist because it's been identified that I've got potentially a condition here and it needs to be treated, and it needs to be treated by somebody who's a specialist in that field. I need perhaps some diagnostic tests because we just need to pinpoint the type of condition it is and the best form of treatment for it. And then also medication. So it may require you to have some medication issued over a period of time, so therefore that needs to be covered. So that, if you like, that's your base element of outpatient. But then after that, you might want to have things like alternative medicine, like chiropractics or osteopathy, that type of cover, homeopathy even. You might want to have down to, I actually would like to access nutritionist care so that I can get a little bit more of an idea of how I can maintain my health better that way. So there's a lot of additional elements that you can add depending on your circumstances from that base level of I just want to have access to primary care and specialist consultations, all the way through to actually I need physiotherapy, I need to have coverage for chronic conditions, I need to have cover for alternative therapies. All of those things can be added up as you go through our different options. And it really depends on the extent that you want that type of cover.
Okay, great. I mean, yeah, so you've got like the ruby, obviously, which is the sort of entry sort of level one, the sapphire being the middle, and the diamond being the, I guess, the full sort of bells and
Yes.
and whistles, right?
Yeah, and it just, in a number of cases, it doesn't necessarily mean that you're getting less cover between them. You just may be getting higher benefits. So it might be that you've just got a higher monetary limit to have your alternative therapies, or it might be a higher monetary limit to have your nutritionist consultation. So in a number of cases, it's more about, actually, I'll need that bit more now. So actually, it would benefit me having a higher level of cover for that. So again, circumstances will change with people, and they'll say, actually, that's more of a focus for me now, so I will scale up my cover accordingly.
Okay, sure. And so, I mean, the benefits for the policy, as we sort of keep touching on, it could be really sort of tailored to what you need. With the outpatient side of it, claiming, which is always a sort of hot topic whenever we talk about insurance, because it's the reason why people buy the policy in the first place.
Yeah.
So with the outpatient side of it, how does the sort of claiming structure sort of work on that? And does that vary between the different levels which you sort of choose?
Not too much in terms of the different levels. I think where you're based in the world will determine whether you may have to pay for that treatment yourself and then claim reimbursement from us. In other cases, we may have direct billing with medical facilities there that will allow that to take place. So if I use Hong Kong, for example, we have a relationship with a company called Specialist Consortium, which allows people to go online and book appointments with a specialist, and then those bills come directly to us. So we try and minimise as much as possible the exposure to you having to pay your bill yourself. And as much as we can, we try and do that. It's not possible to do it everywhere in the world. And so therefore there will be circumstances where people will have to pay and then reclaim. One of the things we touched on earlier, which was the virtual doctor service, what we're trying to do is promote those services that don't require you to pay and reclaim. And so therefore that remote doctor service is a feeless facility. So where, as much as possible, even if we can't provide it in a country, we're still providing a service that will allow you to have that cashless entry point. If that can't be done, then obviously you will need to make a claim. What we've tried to do, again, is make that as easy as possible. So we have a member portal that allows you to upload your claims online, look at the status of your claim, find out whether at what point that's going through the payment cycle or the adjudication cycle. So again, we try and make that as easy as we can. We don't want you to have to post off originals of claims.
Yeah.
So clearly, as much as we can, we try and say, if we can provide cashless, we'll do that. Where we can't, we'll try and make it as easy for you to claim as possible. And obviously, one of the things that we are trying to do is to make sure that those turnaround times for claims payments are kept to an absolute minimum. And for us, typically we're working on a sort of 5-day turnaround. We promise 10, but we tend to deliver 5 because we like managing people's expectations.
Good. So you mentioned there about the sort of network where you can use Generali sort of cashless, really, and where does that sort of expand to? You mentioned Hong Kong has obviously got that ability in certain clinics. Obviously, you can use the plan in other clinics where you just pay and claim. So
yes.
The Generali plan is complete open facility.
Yes, I mean that's the beauty about the individual choice plan. As with a lot of plans which are global in nature, they should be open access. We don't restrict you to where you can receive treatment. Clearly, what we try and do is make sure it's as convenient to you as we can make it. That's not always possible, and you do sometimes need to have to pay and then reclaim to us. But it doesn't restrict where you can go. So your choice, and that's the whole thing about choice with our plans, is that you can choose to do whatever you want to do with the plan in terms of where you seek care. What we give you is the choice of where you might want to access it depending on your circumstances. So again, as we've said, there are lots of different supplemental benefits and services we provide within our plan, which again would be, we talked earlier about in certain places, a second medical opinion might actually be something that you really value because you're not sure about the facilities and the ability to treat effectively in a particular place. And what it will do is to say, look, this is your best health outcome. That might mean you travelling to another place in the world, but you've therefore got that choice to do, and you've got the choice to stop and make that determination before you go ahead with treatment. And the whole thing about our choices, if you like, style of plans is that we try and wrap that into the plan design itself. So you do have that element of choice of what you do next, and giving you a bit more of empowerment on how your health is treated, full stop.
Okay, great. I mean, the Generali plan, so the outpatient side of it sounds like there's some unique ways to sort of claim, and hopefully less hassle for submitting those claims for members, which is always sort of music to our ears as a broker, because obviously we recommend these sort of plans on the good word and things like that. So what about when it comes to something major where you would need to go to a hospital? How would that kind of work?
Well, in the main, you are free to go to the hospital straight away, but we recommend contacting us first, unless, of course, it's an emergency, in which case you must go to the facility. But as much as possible, it's about us being able to link with the medical facility almost on a clinician-to-clinician basis, because what we're trying to make sure happens is that you get a good point of entry. Everybody knows what's going on. We know what treatment's going to be undertaken. There's no surprises about how that treatment's going to be exercised. We can then make sure that we keep an eye on you and that nothing sort of untoward is happening. That it means that we can make sure that the bills, even when complications take place, are always met by us without, again, us having any surprises. And the reason why we do it is because it is much easier for our clinical team to be talking to the medical facilities clinical team rather than you feeling that you're not in control. So as much as possible, that's why we want to make that connection. We want to make that connection through being able to speak to them beforehand and issue what we call a guarantee of payment, which means that we've committed to paying for the treatment that's being undertaken, but we know what treatment is being undertaken, so we know it's fair and consistent in the way it should be. So that's really our main thing when people are using the hospitalisation piece is call us first. It's for no other reason that we want to have that dialogue with the medical facility. So your experience there is as best as we can make it.
And from a patient perspective, concentrate on getting better without the headache of
Exactly
dealing with an insurance company, right?
Yes, indeed. Indeed.
Good stuff. So, Stuart, thanks very much for your time. I really appreciate you agreeing to do this with us again today.
No problem.